So the continued decline escalates. The manufactured decline, and that's what it is. You'll see more and more of it, as I keep saying. Yes, Lurie's Children's Hospital, and this is one of Northwestern's hospitals. Communication outages hit day 8, and parents are hitting the wall. I'm angry. I feel neglected. Yeah, because they're, as you can see here, all phone, email, and electronic systems were taken offline as part of the hospital's cyber attack protocols. Yeah, so they're doing this, okay, because this is in 2023, there were the most hospital cyber attacks, okay? Again, this is manufactured, it's designed. I know that that's probably very hard for people to understand. It shouldn't be. The hospital CEOs are all about money. They're also all about Medicare for all. Here's the problem with Medicare for all. People think that it would be like what the elderly live on, which, or the you know, it would be Medicare. No, what you would have, what we all would have, first of all, it would take away from what those people have because we can't afford it. But we have the associations of nursing and medicine that say, well, we just need to tax people more. Well, those people should shove it up their butt. Okay? We have enough taxes coming out of our checks. But what the healthcare system, the health insurance you would have under Medicare for all would be what our vets have. I think most people in the country know how vets are treated, how bad their health system. They don't have the same as what the elderly have. So that's what it would be. The elderly would be under that. We all would be forced under that. And that's what this is all about. It's to force the breaking of the entire healthcare system because they will break it to force in their sick socialism. What I don't understand about this, especially as a nurse and somebody who's had to listen to, watch, hear forever since I've been a nurse about HIPAA, is why haven't any of the hospital CEOs or the administrators, because they have entire IT departments, okay? So this is not just, happening accidentally, okay? In fact, I think I just saw one with Lurie's. It's a known, they know who it is that's doing it. So this is so manufactured. But there should be HIPAA violations placed on every CEO. Now they're going to tell you, no, we've protected your data. Bullshit, it's a cyber attack. And here's the problem when you merge all hospitals together and you have them all under the same charting system, which is Epic. It's under every hospital is Epic charting, and most of the hospitals it transfers. You can see from other visits where they were at other hospitals. So that puts everybody at risk. That's how stupid the experts are that came up with all of this. But again, this was all done. The merging of hospitals, the putting everybody under one charting system for Epic. None of that is safe. None of it is. None of it is safe. Allowing hospitals to merge was not safe. Allowing every hospital to be under the same charting system is not safe, because then when one hospital is affected by a cyber attack, that can affect every other one, because many of the Epic charting crosses over. Now they'll tell you, no, that hasn't been affected. No, there should be criminal penalties against these CEOs because they're doing this for one reason. Cyber attacks are having fatal consequences, so the White House wants hospital funding tied to hospital security. Yes. More reason that more money will have to be paid, and then the hospitals could say, we can't afford it. We can't afford it. Oh, no, we're going to have to close. We're going to have to close this department. And it's like, oh, it all works for you, doesn't it? Because then you can force the federal government to come in more and more and more till the federal government is fully running the healthcare system. So, yeah, there's a lot of people that are heading up healthcare that really should be charged with crimes. I mean, legit crimes. Because they're putting everybody at risk. And there's never any penalties to them, is there? None. I mean, the most cyber attacks to hospitals were in 2023, so it just increases. So does it seem like it makes sense to continue down the track? So put it this way, doesn't it seem like the simplest solution to this would be force the hospitals to break up and go back to being independent, and then don't allow them all to be on the same charting system. They like to say that we have the same charting system because then it's continuity of care. I don't think that, I think we did okay before that, and it seems to me that more people have, more hospitals have come under cyber attacks, a whole bunch of them I'm going to show in a minute, that have come under these cyber attacks, and it puts all of us at risk. Your most sensitive data is in those hospital charts. Do you realize that? Everything about you. And yet there's never any penalties to these hospital CEOs. None. Does that seem like it's fair? Well, it's not. But of course, we don't live under a fair system. This was 2023. Cyber attacks on hospitals are growing threats to patient safety, experts say. Yeah. Yep. And so you could see here they were already doubling. Exactly. That's why I said it's a manufactured decline. So now in 2023, these cyber attacks are at the worst. Or in 2023, there were the most in 2023. It's this manufactured. It's slow, but as it goes along, you're going to see it speed up. The mounting death toll of hospital cyber attacks. Cyber attacks on hospitals surged in 2022, leaving patients at risk and underlying the human cost of cyber attacks. So this goes to all of the people that Congress and the House allowed to have a seat at the table because they decided to listen to a bunch of bullshit artist lobbyists at American Nurses Association, American Medical Association. That's how we got here. That's how we got here. They should no longer have a seat at the table. They should no longer be listened to. They are not expert. It's simple. Hospitals never should have been allowed to merge. They never should have been allowed to become one healthcare system, and they never should have been allowed to all come under the same healthcare charting, because that is what, as I just keep saying, will lead to more chances of everybody being put at risk. And because there's nobody in our federal government that will hold these hospital CEOs accountable for themselves putting all of their patients at risk and having their data, them all causing a HIPAA violation, there's nothing done to them. But to the nurse, to the little workers, oh yeah, they'll go after you. These people should, if we had an ethical system, these people would be charged with criminal crimes. That's the only way you'll stop this. Otherwise, they have too much money and they will just keep going along with this. And it's putting our entire country at risk. And this was a recent one. Northern Light Health says patient records are safe after weekend cyber attack. That was 3 days ago. Yeah, of course they're going to tell you that the records are safe. They don't want to be charged with HIPAA violations, but it's cyber attacks. You don't know that just because they say it. I wouldn't believe any. There's a reason I've said the people I trust least in this country is the heads of every hospital and the heads of the universities, because they have all our data, and I've seen what these people are like and what they've been allowed to go along with, and they just are not people that have a conscience. So I trust them the least with data. So I don't believe this at all. It's a cyber attack. You have to take everything. It's such a bad cyber attack. You have to take everything offline, phones, all of that. And yet, there's no penalties to these hospital CEOs when they have these huge, huge IT departments. And even with those huge IT departments, they can't keep anything safe. And with the Northwestern one, or the one at Lurie's, they know who the cyber attack is. They know who it is. And yet they still haven't been able to put their system back up. So there's something strange going on too. Like where I work right now, it's paper charting, which that's a little funny in itself. But the freestanding psych hospitals, they don't operate under the Epic charting. So just very strange. But in the hospital I'm at now, they don't even allow you to email from, like if I wanted to email my manager from my home email, you can't do that anymore. They won't allow you to send anything to your home email or email. So there's just something shady with all of this, and all of these people need to be put under investigation because many crimes have been committed.